And welcome to the channel GDC English. In this video, we're gonna have excretion of drugs. Okay, what is excretion of drugs? That is the removal of drugs from the body. All right, so it is the part of pharmacokinetics. So let's start with the excretion of drugs. What is excretion of drugs? So first of all, we should know the major route of excretion. The major route of excretion is what? Is kidney, isn't it? Yes. And what is the structural and function unit of kidney? Structural and functional unit. Structural and functional unit of kidney is nephron. Yes. So nephron is the structural and function unit of kidney through which the drugs excretes out from the body, isn't it? So we do have three phenomena while the process of excretion, isn't it? The first one is the glomerulus filtration. Glomerulus filtration. Second one is tubular reabsorption. Yes. And third one is tubular secretion. Tubular secretion. But why do we need to excrete the drug? Why? Why there is a need? Why there is a need of excretion? Why is it so? Because the drugs are not endogenous, they are the exogenous part, isn't it? These are the exogenous, which are taken externally inside the body. Yes, it is an exogenous part, it is not an endogenous part. So it has to be excrete out from the body through the kidney, isn't it? If it gets accumulated or stays inside in the body for a long time, what will be the consequences? The consequences will be the toxicity. Toxicity is a harmful thing or consequences of a drug that can be occur even after drugs accumulate inside the body. All right. So this is the side effect of drug when it is being accumulated inside the body. So to remove that, there is a process known as the excretion of drugs. All right. So for the excretion purpose, major of the drugs excrete out through urine, isn't it? Through urine. Yes. So drugs should be of which nature? The drug should be of the hydrophilic nature, isn't it? For the hydrophilic nature. Why is it so? Because urine is also quite watery in nature, and to mix that drug into the urine part, the drug should be also hydrophilic in nature, isn't it? If the drug remains lipophilic, it will not be able to excrete out from the body. Yes, so that is a concept that drug also should be hydrophilic in nature. Drug should be also hydrophilic in nature to excrete out through the urine. Yes, so this is the concept behind the excretion. Now let's move on to the first part, that we have the structure of nephron. Yes, so this is a glomerulus, and we do have over here like this, isn't it? So this is something like glomerulus. Glomerulus. This is like the PCT, proximal convoluted tubule. What is it? Proximal convoluted tubule. Yes, this is in ascending loop of Henle. Ascending loop of Henle. And this is the descending loop of Henle. Yes, this is the distal convoluted tubule. Yes, distal convoluted tubule, and this one is the collecting duct. Collecting duct. Okay, it is. So this one is the structure of a nephron. Yes, distinct PCT, proximal convoluted tubule. This one is descending loop of Henle, ascending loop of Henle, distal convoluted tubule, and the collected drug. And here you will form your urine over here. All right. All right. Now there are the process which we have in this section. That first one is glomerulus filtration. Now let's talk about the glomerulus glomerulus filtration. What is it? So what is it? So glomerulus filtration depends on plasma protein binding, plasma protein binding, and renal blood flow. All right. So if the drug size, that is the drugs size increases, it will not be able to filter out through glomerulus filtration. It is just like a what? It is just like a filter paper. It is just like a filter paper. Just like a filter paper through which the drugs are strained out from this, isn't it? So the drug only which strained out or filter out from the glomerulus should be of less size. Yes, that is for less size only. That is below 6,000 Daltons. 60,000 Daltons, sorry. 60,000 Daltons. Isn't? Yes. So the drugs which have the less size, like that is 60,000 Daltons, less than that 60,000 Daltons, that only can be passed through the glomerulus. That is a like filter paper. All right. So if the drug still have a protein binding with it, that drug cannot be able to cross that glomerulus. Yes. Also, whether when you have increased rate of flow, which flow? Blood flow. There is a thing like that. There is a thing like that, which is over here. This one is afferent, and this one is efferent. All right. This is an afferent blood vessel, and this is an efferent blood vessel, which gives the blood flow or blood supply towards the glomerulus, through which the drugs filter out from here. All right. So glomerulus filtration depends on the plasma protein binding and the renal blood flow. Okay, isn't it? So these are the things. So it is not does not depend on it is does not depend on lipid solubility. Lipid solubility. Okay, because all substances, whether lipophilic, hydrophilic, ionized, unionized, all the drugs can be passed through it, but it should be of less than 60,000 Daltons in size. All right. So this is the concept of glomerulus filtration. All right. So now let's move on to the tubular reabsorption. What is tubular reabsorption? Isn't it? So this one, the tubular reabsorption is just like a reabsorption process. That reabsorption means that reabsorption of drugs which are lipophilic in nature into the blood circulation. It gets reabsorbed into the body. It will not be able to excrete out. Yes. So it depends on the lipid solubility. It depends on the lipid solubility. The drugs which have lipid solubility in nature will not be able to mix with it. Mix with what? Mix with urine. Yes. So the drugs which have the lipid solubility are reabsorbed. Are reabsorbed. Yes, generally tubular reabsorption takes place from the PCT. From the PCT. This part. This part is PCT, that is proximal convoluted tubule. Tubular absorption, reabsorption takes place through PCT, proximal convoluted tubule. Here also, apart from the drugs, all the nutrients, amino acids, glucose, proteins are reabsorbed. Are reabsorbed from this part. That is for tubular reabsorption. All right. Now, there is a thing that is acidic drug poisoning. That is acidic drug poisoning. What is it? Acidic drug poisoning is a poisoning of acidic drugs. For example, salicylates, slates, barbiturates, barbiturates, isn't it? So these are the acidic drugs which may cause the acidity in blood. Acidic blood. Acidic blood. It may show the acidic drug poisoning. So, to excrete out these drugs faster, what should be done? What should be done? So, if they will be in unionized condition for a long period of time, what will be cause? It will cause what? It will cause the acidic condition, acidic blood, acidic drug poisoning, isn't it? So, to increase the excretion of these drugs, the urine should be alkalinized. 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 By which thing? By which thing? By which chemical? That is the important thing, that NaHCO3, which a sodium bicarbonate, which is a sodium bicarbonate, this is used to alkalinize the urine. This is used to alkalinize the urine for excretion of drug. Yes. So also, for if we talk about the basic drug poisoning, the chemical is given as the chloride. Ammonium chloride to acidify the urine, isn't it? So this one is the poisoning concept. All right. We do have another thing, that is tubular secretion. Tubular secretion. What do you mean by the secretion? Secretion is just like a unmasking of something. That is a wild card entry. All right. So tubular secretion generally takes place from the DCT part. That is the in the DCT, distal convoluted tubule. Distal convoluted tubule. All right. Now, generally, what happens? It has the pumps, it has the pumps. This one and this one, and generally secretes the acidic and basic drugs. Acidic and basic drugs are generally secrete into the lumen, isn't it? That is the lumen part of the nephron. All right. So, for example, there is a pump for acidic drug, and here we do have pump for basic drugs. All right. So not they will not work simultaneously. One only will be open at once. All right. So, for example, and also one drug will excrete at one time only, isn't it? So we do have an example, classical example. We do have that penicillin penicillin, and here we do have propane acid plus uric acid. All right. So what do we see here? That for acidic pump, propane acid decreases the excretion, that is the secretion of penicillin propane acid to allow the excretion of uric acid. All right. Propane acid competes with penicillin and decreases its secretion and allows uric acid secretion into the lumen. That is in the case of tubular secretion. All right. Now we do have another thing, that what is the net formula? Net equation. Net equation. Net equation is glomerulus filtration minus tubular reabsorption plus tubular secretion. That is the amount of urine formed. All right. So this is all the concept. This is the concept of excretion of drugs. Now let's move on to the MCQ part. So first we do have this one. Which of the drugs factors favor glomerulus filtration of a drug? Which of the following factor favor glomerular filtration of a drug? High plasma protein, lipid solubility of drug, ionized free form of drug in plasma, or large molecular in size. So I have just told you that those drugs only which will allows or which will pass out through glomerulus filtration is the ionized free form and the drug present in the plasma, isn't it? Which should be less in the size. So C1 is correct. Yes. Which process is responsible for active and energy dependent transport of drugs from blood into renal tubules? That is in the case of the tubular secretion. That is active tubular secretion. The word itself says. So active means consumption of ATP. Consumption of ATP. That is the energy dependent, isn't it? That is the energy dependent. So what should be the answer? The answer should be the tubular secretion. All right. So tubular secretion is a process responsible for active and energy dependent transport of drugs from blood into renal tubules. Yes, chalo. Alkalinization of urine, that is from the sodium bicarbonate, enhances excretion of which type of drug? Alkalinization of urine is being asked over here. So alkalinization of drugs should be done only in the case of the acidic drug poisoning. Yes, so the acidic drug poisonings may cause through salicylates and barbiturates. Yes, the answer would be the weak acids. Yes, and for weak bases, ammonium chloride is being given. Amphetamines. A patient overloaded on barbiturates, weak acid, which of the following intravenous enhances the renal excretion? Weak acid, barbiturates. Just the similar kind of questions that we have over here. Here also we do just what? Alkalinization of uric with sodium bicarbonate. Yes? Yes. Chalo. Which drug-drug interaction is explained by the competition for tubular secretion? I have just told you guys that propane acid and penicillin is the classical example of competitive for the tubular secretion. Here, what do we see? That propane acid decreases what? Decrease in secretion of penicillin. Penicillin. Yes, to increase the excretion of uric acid. Yes, chalo. Which type of drug is least affected by the changes in urinary pH? Which type of drug is least affected by changes in urinary pH? Weak acids, Weak bases, strongly ionized drugs, or weak electrolytes. What is it? So, weak acids can be excreted fastly when there is an urine alkalization, and weak bases will be excreted out when the urine will be the acidic in nature. But there is nothing happen. There is a least affection on the strongly ionized drug. Least effect on strongly ionized drugs because they are already ionized in every pH. So nothing can do of them. All right, nothing can do of them. Strongly ionized drugs will always be the strongly ionized, and nothing can touch them, isn't it? So this is all about the topic excretion, and I expect from you guys that you will easily crack all the other questions as well from this topic. So I hope I have made you clear around this topic. Until then, please stay with DC. Thank you so much.